Welcome to the Stone Soup Recovery Podcast. Your host, Adam and Sean, will talk about their lives and living in recovery.
Hello and welcome to Stone Soup Recovery Podcast. My name is Adam.
And I'm Sean.
Thanks for listening to us tonight. The topic of conversation tonight is we're talking about mental health and recovery and what that looks like for a lot of people. There's a lot of people coming in and out of prisons with mental health issues. There's a lot of people in recovery with mental health issues, and it's just not talked about enough. And so that's what our topic is going to be this evening. So I guess I'd like to begin by saying my name is Adam and I'm in recovery. And I am someone, too, who is diagnosed with bipolar. And I'm also someone who is an alcoholic. And those two things have collided over the years. And they've caused me a lot of problems. Well, in a lot of ways, I didn't understand what it was like to be. I didn't have a diagnosis of being bipolar for many years, and I drank. I found out later that part of the reason I drank was self-medication. I was self-medicating the mental health illness that I wasn't even aware that I had.
You were never diagnosed in school with anything, ADHD or?
Hyperactivity is what they called it back in the 70s.
Yeah.
And they gave all the kids Ritalin,
Mm-hmm.
And so, yeah, I was a Ritalin kid.
Wow. Were you on that for very long?
I don't remember. I was really young. I think I was on it for a couple of years, but I'd have to ask Mom and,
Yeah, that's a pretty powerful drug.
Well, it changes a person too. And I've read studies as well that people who have ADHD and are at a young age can oftentimes develop bipolar as an adult in their early 20s. And I believe that's what happened to me. And to this day, I take, as part of my recovery, and it's so important, Sean, that we do this, we go to the doctor, we have the conversations with the mental health specialists, and we take the medication. For many years, like I said, I didn't know. I thought I was just broken. I just thought, going in and out of jail was normal. I thought that it was normal for me to never have any money and to, sleep on the streets. And I consider that to be normal in my life. And when it became normal, I couldn't see a pattern. And so I was constantly fighting mental health disorder and alcoholism at the same time. And my life was in the middle of those two forces, and there was destruction and chaos that came out of it.
Right. Yeah.
The big book talks about, in step 2, came to believe in a power greater than ourselves could restore us to sanity. Well, if it has to restore us to sanity, if God's restoring us to sanity, then that means at one point we were insane. And there's a difference. there's a difference between the insanity that ensues from the drinking that we all know. I mean, the imbalance in your life with your friends and your family and your job and all the problems that it can cause. Because when we're drinking, we think we're absolutely 100% correct. At least I know I did. And so for a lot of people, this is something that isn't talked about. For a lot of people, this isn't something that's discussed. And I think that if we can bring awareness to it and we can start a conversation about it, then maybe some good things will come out of it.
Yeah, I think it's hard for a lot of people to discuss mental health issues, honestly. It's been shunned for, most everybody's growing up life. You don't want to be labeled that.
Right.
You don't want to be crazy.
Right.
If somebody thinks you're crazy, then, they're going to talk about you and tell everybody else. And then you're just the weird one standing there by yourself.
Right. And that's how
But,
it is too. There's a social stigma.
Yeah, there sure is. But, yeah, my drinking didn't start really until after I was an adult. I had my first drink when I was, I don't know, maybe 12.
Oh, wow.
My sister took me out in her car and introduced me to alcohol, cigarettes, and marijuana all at the same time. I went home and got sick.
Yeah, I bet. 12 years old.
Yeah. She was about 15 years older than me. She was my stepsister. So.
I understand.
She was a little bit more experienced than I was. She was teaching me really fast.
Real fast.
But yeah, she did that a few times with me, and it really wasn't an issue though as a teenager. And I had other issues as a teenager. I was having a hard time in school, and boys was what was on my mind.
Boys,
Yes.
typical teenage girl.
But yeah, after school, I got married real young. I was 18 when I got married, and
That is young.
started having babies right away. I had them like stair steps, and before I knew it, I was a mom of 4 children at the time. And, I didn't even know what I was going to do with my life at that point. I was just so young.
Yeah.
And I'd already experienced so much in a short time. Fast forward a little bit further, and my drinking started to pick up a little bit of speed through those years of rearing children, but I was just too busy. But I knew, though, at the time that it could be a problem. I would go to friends' houses, to their parties and things like that, and take alcohol and then drink it all. Not
Right.
being able to not drink it all. I couldn't leave with any alcohol. I had to just drink it all.
So looking back, you can see that behavior.
Yeah, I could see that I was pretty leaning towards alcoholism, but just wasn't full blown or anything
Right.
at that time. I was just dabbling in it a
Right.
little bit, but I did associate it with at the time, that I could possibly become an alcoholic if I'm not careful.
If I'm not careful.
So fast forward, anyways, I ended up having another baby. So I had 5 children altogether. And then in 2008, I went through my first marriage. I went through a divorce. In 2008, I was married to my third husband.
Mm-hmm.
And he and I both had gastric bypass surgery,
I understand.
which a lot of people don't really know what that is.
Yeah, why don't
but-
you tell us a little bit about that?
Just a real quick summary about gastric bypass. It's a procedure that they do. It's a major surgery, and they disconnect a little portion of your stomach, and they bypass your large intestine and hook it to your small intestine, and you no longer absorb as many calories, and you don't absorb nutrients, because I'm always nutrient deficient.
Yeah.
I'm always anemic terribly. I've had to have infusions because of it. But so it helps you to lose weight. And so the first year or two, my husband had it as well. We both did in 2008. It was actually the surgery that afterwards, a couple of years afterwards, is when I really started to drink a little heavier. I was drinking wine at that time, and I would have my afternoon cocktails and stuff. But then my mom, she started to get sick, and she lived a little ways away from me. And so I ended up divorced again. So I went through a lot of traumatic things throughout my life.
Emotional experiences.
Yes. And my mom got ill, and she needed my care. And she and I were always very close. She was my best friend throughout my whole life.
That's
And
awesome.
she got sick, and eventually she ended up passing. And so my alcoholism just really then spiraled. And with the gastric bypass on board, it just made it so that when I would drink a little bit, I would be totally intoxicated. It would hit me so hard. Alcohol totally bypasses your upper intestine and dumps into your lower intestine and goes directly into your bloodstream. So for me to drink, say, an alcoholic drink, and you to drink an alcoholic drink, I would probably be drunk by the end of that that beer or whatever, and it would take you another probably 4 before you would feel the same
7.
effect that I feel. Yes.
True alcoholic, I need 7 or 8 more.
Well, my tolerance built too. After my mom died, I just didn't care anymore. I mean, I went through my last divorce, and my kids were grown, and my mom, she passed away, and I didn't know what I was going to do with my life. I had a lot of things on my plate, and alcohol was the easy thing to turn to. When my mom was sick is when I really started to turn to alcohol, because that was my treat for the day. All day I take care of my mom, and I would be at her beck and call, and I'm not complaining, because, like I said, we were so close.
Sure.
But it took a toll on me.
Of course it would.
It really did. I started losing my identity. I wasn't able to do the things I loved anymore. She was a full-time, patient for me.
Your life
at
changed.
that point, yeah. She was still my mom, but then, she really wasn't my mom anymore. I had to take care of her all the time. And that lasted for about a year and a half. And so at the end of the day, they'd have happy hour downtown, and I would just, I had a little side-by-side, and I'd get in that thing, and I'd drive downtown, and that would be my away time, away from all my problems and my life and my mom and everything. And they'd have happy hour at the restaurant there, and that became my new norm for about a year and a half every night. And I would go down there, and I would order margaritas, and I was regular. They knew me by name. And I would sit up to the bar, and they would pour my drinks, and then they would pour even more.
Yeah.
They'd top it off.
She's a regular. Hook it up.
Yep. And they were strong tequila. And I would drink about 4 or 5 of those, and then I would get my little buggy, and I would drive home. And I hadn't eaten all day. I hadn't had time to eat.
Right.
I'd been busy with my mom and stuff. And so by that point, I was pretty intoxicated. So, yeah. So that's about my story in a little nutshell there.
Yeah. Well, thank you for sharing that. It's gastric bypass. I never would have, until you taught me about it, I never would have understood or realized the difference between, I mean, if you think about it, it's a straight pipe right to your,
Yeah.
So when you drink, it's like right now, it's going to happen.
Yeah. Usually I would get through about halfway through my first drink, and I was already feeling intoxicated, and then I wanted more of it. It was quick, it was fast. It helped me forget my problems right now. It was my treat for the day. I deserved it.
Yes.
And that's what I did. Mm-hmm.
Yep. And I, for me, my drinking was a little different. I realized later, looking back, hindsight, I was self-medicating in order to deal with the things that were going on in my life. But the problem was that it was the alcohol that was really causing the problems. And I was running to it as a savior almost to fix everything in my life. I'll just drink. Mm-hmm. I'll just drink. Things will get better eventually. I'll just drink. And had I been in an active addiction and had a gastric bypass, I don't know, I wouldn't have a liver.
Well, that's pretty much what happened to me. My mom passed away, and I inherited a couple of houses of hers, and I decided to make a bed and breakfast out of them.
Right.
So that just added more onto my plate.
More stress.
And definitely. I was not ready for any of that.
Anxiety, stress.
And my drinking became worse, and I had the rule that then at that point, it used to be happy hour was my cocktail time, became 3:30, became my beer 30 time.
Yeah.
And I would drink any time after 3:30. And then when that wasn't working for me anymore, it was noon. So I was pretty much getting out of bed and maybe eating breakfast and then hitting it,
So you just started to move that clock back in order to fit your drinking habits.
Yes.
Yeah.
It got to be where I couldn't wait till 3:30, so I had to have it sooner. And as long as I don't have it before noon, then I'm still good.
Yeah.
If you put rules on it, then it's not a problem.
I used to try to do little things like that to control my drinking. I would put a line on my bottle. If I don't drink past this, I can drink this much. Mm-hmm. You know what I mean?
Yeah.
And that didn't work because I kept moving the line. Kept moving the line. So at the end of the day, it just doesn't work. The only thing that works is truly forgiveness for me. It's very important to me that we talk about the mental health illness that's going on in the world and what's happening to people who have mental health illnesses. A large majority of them are ended up in prisons and in jails for psychosis episodes that should be treated at a hospital, that should be treated, their addictions should be treated in a treatment center or with the proper, services. And none of that is happening. None of it is happening. And I've talked about this on a podcast before. I've got a friend who's coming out of prison, and there's no resources. And, he has a mental health disorder, severe anxiety disorder. You know what I mean? And I think some of that may be contributed to his actual being in prison actually causing mental health disorders. And that's a whole nother topic that we can talk about another day. I find it interesting. I ran across a psychiatric report from Cornell University. And one of the side notes that really caught my attention was the rate of mental health disorders in incarcerated population is 3 to 12 times higher than general community. Disproportionately, people are being locked up. Mm-hmm. Disproportionately. And when they get out, there's nothing to treat them. And something has to be done, but I don't know what. It's bigger than me.
Yeah. Well, it just takes one person to get the, snowball rolling.
We're trying. We're starting the conversation.
Yeah.
It's a lot. For me, it's close to my heart because of my own experiences and the fact that, I have been to prison and I've been on the other side of that wall, and I've been the one who was bipolar, and I've been the one that was alcoholic, and I came out into the world from prison with no resources, none, and it was a struggle. And so I find other people who are going through the same thing, and I want to help them. But I don't know how much of that I can truly do. Now, at least not on my own. And it's just something that really, the mental health issue people have ignored, they've shunned, and they don't want to look at. No one wants to admit. Do you think I want to admit all the time that I'm bipolar? That's something that I don't want to admit.
Yeah.
But it's the truth. I don't meet people in the street and say, "Hi, my name is Adam and I'm bipolar," but at any rate, to myself, it's private. And I have to ask myself, is it because I'm afraid of being shunned? What? It's just, there's a stigma.
Oh, yeah, sure is.
And I know in my drinking, at one point, I didn't have a bipolar diagnosis. I didn't have it. And so I lived my life in this state of chaos between drinking and bipolar psychosis, if that's a good term for it. And all this havoc came out of it. I mean, I hurt people, I hurt myself, and it was terrible. And then I got a diagnosis of bipolar. So hey, I got something here. It's a diagnosis, but I still had the untreated alcoholism. Mm-hmm. So they, I went to the doctor. I got the diagnosis. They sent me home with these meds that are supposed to help me, and I took them, and I felt great for a while. And I even was able to stop drinking for almost 2 years. I was going to meetings. I was, reading literature. I was talking to people. I was doing the next right thing. I came into a point where I thought, well, I don't need my meds anymore. I don't need them. I'm fine. There's nothing wrong with me. Bipolar. I'm not bipolar. I'm just, I was just the alcohol in my life. So I had the bipolar actually under control, and I had the alcoholism treated. I was in recovery for it. So I would stop taking my medication. Then pretty soon I would start drinking again. That's what happened. Is I went almost 2 years without drinking. I stopped taking my medication, and I got trapped in this downward spiral that I was out of control, and I couldn't stop it. It was beyond me, because first of all, here I am, an alcoholic, bipolar, not on my meds, trying to solve real world problems with bipolar alcoholic thinking. And I still, for a long time afterwards, thought there's nothing wrong with me. It's not me. It's just the alcohol. I blamed it on the alcohol. It wasn't until later when I got truly, truly sober and started taking my medications and talking to people and educating myself on it that I learned I have to, then it's a big part of my recovery to take my medication every day. Because if I don't, it's going to lead me down a path that I don't want to go. And I've been down that road.
Right.
And it's a bumpy road.
Yeah, you've done that before, and you're just getting too old to do that that song and dance again.
Well, I bumped my head on that problem enough. You know what I mean? And that's why, it's just really important to me that I take the medication and that I do what I need to do. It's just part of my recovery. And for anybody listening who may be on medication, take your meds. Take them. And don't think that you don't need them, because if you have them, then perhaps you do. There's been a high rate of alcoholism and mental health disordered people going to prison and getting incarcerated. And the number one major diagnosis for people is major depression and bipolar. And to me, I find that extremely interesting, because I have to wonder if they came in with a preconceived condition or if it's part of their environment.
Right.
So that in itself is a whole nother conversation.
Yeah.
I know for me, in my drinking, I couldn't make a good decision. I was off my meds. I'm drinking. I'm trying to live in this world that I don't understand. I'm trying to live in this world that doesn't understand me. So I constantly got locked up. I constantly lost friends. I couldn't work. I couldn't keep a job, But once I was able to put all the parts together and all the pieces together, there's hope. There truly is hope. It seems that, AA, they've talked about this before in chapter 5 of the Big Book. And I'd kind of like to read a little bit about it. In chapter 5 of the Big Book, it talks about how we can overcome if we can only be honest with ourselves. And it talks about how others, there are less unfortunates. They are not at fault. They have seemed to have been born that way. They are naturally incapable of grasping and developing a manner of living which demands rigorous honesty. Their chances are less than average. You have to be honest in everything that you do. You have to be honest. Their chances are less than average. There's those too who suffer from grave emotional and mental disorders, but many of them do recover if they have the capacity to be honest. So there's hope. We can recover. We do recover. People with mental health illness who suffer from alcoholism or addiction there's hope for us. And I'm thankful that there's hope. I'm thankful that we have that.
Yes, in 2008, I was saying that I had gastric bypass, and I had the Roux-en-Y procedure, which is a pretty intrusive surgery.
Okay.
And it was after then that I started to drink heavier, and I started to notice now, not then at the time, that it was becoming a problem. And then my mom passed away in 2015, and it was just soon after that I got the call from my doctor who said, you know, Sean, your kidneys are failing, your liver's failing. I know you're drinking a lot. What's going on, you know? And I had to go in for some ultrasounds and things like that to make sure that everything was okay. But it was right about that time when I got the real scare that said, you know, if you keep on like this, you're not going to be around. Your body is telling you right now that, you know, 2 organs are telling you that you're not doing well. And on top of the gastric bypass, which was already attacking my body, you know, I decided I needed to do a change. And so I did. That's when I decided that I wasn't going to drink anymore. And I'm not going to say it's been an easy road, and I'm not going to say that I didn't have a relapse, because I did.
Right.
But it didn't last for very long, and I got back on the program. And
kept moving forward.
Yep, here I am, 2 years sober. So
That's awesome. Congratulations.
Yay, thank you.
It's awesome. Yeah, I think for the most part, a lot of people, they don't understand what it's like for people with gastric bypass and a condition that very few people, it's a low percentage of the population actually has. So a lot of people doesn't know about it.
Yeah, right. Well, apparently there have been a lot of studies done on gastric bypass and alcoholism, and it seems to be pretty prevalent in the Roux-en-Y procedure, what I had done, and it's the way that our pipes are rewired that seems to do. I'm not saying that other people don't have issues or, you know, whatever. I just know that I had the surgery that was going to set me up for a problem. Yes. But according to studies, you can Google this, is what I did. That's how I got this percentage. Some 20.8% of gastric bypass patients develop symptoms of alcohol abuse. This is compared to just 11.3% who develop disorders within 5 years. Gastric bypass causes greater alcohol spikes in the blood, prompting addiction.
Wow.
Yeah. So that's the end there, you know, 20%. One in five. I was one. And I'll tell you, my ex-husband, he also had the surgery at the same time I did in 2008. And he was an alcoholic beforehand. He's always been a drinker. But after the surgery, he was like me. He just went, wow, right downhill.
Yeah.
Fast. So.
Alcoholism and gastric bypass, alcoholism and mental health illness.
Well.
How do you feel about mental health illness in conjunction with alcoholism in your life?
Well, I also have mental health issues. I suffer from bipolar disease, and I take medication for it. I went untreated until I was about probably 35, I guess. I had a doctor who said, hey, I think this is what you have. What do you think? And I'd never heard of it. I said, I don't think so, but whatever, you're the doctor, you know. And they prescribed at the time Zyprexa, which just knocked me right out. So I didn't have a very good idea of what medication for this bipolar stuff was all about.
Correct,
So
yeah.
I really wasn't medicated for a long time. But by the time I went into my gastric bypass, I actually was on great medication. I was seeing a doctor by that point in my life, and I was doing well mentally. And then as my life spiraled out of control and the alcohol became a bigger problem for me, you know, I as you did, decided, hey, maybe I just don't need this medication.
Yeah.
It's cramping my style. It's in my way right now. And so I stopped taking it. And the alcohol, actually, when I was in full alcoholism, it made my mind just so paranoid and so scared and so weird, like different than my sober brain is, you know? And it made my bipolar disease even worse, obviously.
Yeah.
without taking medication on top of it. Yeah, I just had a lot of hard times as well.
It's a very common thing, and a lot of people are unaware of it. And so we're just trying to bring the light to it today. And we are thankful for the fact that there are people out there that are willing to help and to give us information that we need in order to deal with our bipolar and to deal with any problems that we may be having.
Yes, if you know anyone or yourself is in need, the National Mental Health Hotline is 866-903-3787. That's 866-903-3787. Or you can contact them at thementalhealthhotline.org.
That's awesome. And it's great that they have something like that. And, maybe somebody listening, maybe they'll use it, baby.
Mm-hmm. I hope so.
Maybe they'll use it. Well, us here at Stone Soup Recovery Podcast would like to thank you for tuning in. We'd like to thank you for listening. And my name is Adam. Thank you.
Bye.
Bye.
Hey guys, listen up.
Hey, we just wanted to give a shout out to our friends over at 217 Recovery Podcast, Corey and Marnie. They're great people. They got a wonderful podcast going. It's 217 Recovery Podcast. Tune in and give them a listen.